Good morning, one and all. This is Dr. Lakshmi, consultant obstetrician and gynecologist in Medicover Hospital. I'm over here as a consultant to treat the high-risk pregnancies in women. Today I'm going to talk about high-risk pregnancy and care management. What exactly is the high-risk pregnancy? Nowadays, in present changing scenario, all the pregnancies, irrespective of the age, irrespective of the time of conception, everything is considered as a high-risk only. But when it comes to really high-risk pregnancy, it all depends on what age the woman is conceiving, what are the pre-existing medical disorders like diabetes or hypertension or any thyroid associated factors or simply for example polycystic ovarian disorders or heart disease complications. All those things does occurring before becoming pregnancy. So when the woman becomes pregnant with these enumerated list of problems, they should need to go to a consultant, especially both the treating doctor, treating physician, and who would be gynecologist to control the things first, most important before planning for the conception itself. The pregnancy case starts prenatally, that is the woman. When a woman plans for pregnancy, the time starts from that time onwards. So if the woman is, for example, having high blood pressures, so she need to keep her blood pressures under control before she plans for pregnancy. Same as if the woman is having diabetes, we should know what kind of diabetic medications she is taking, how to control the sugar levels, because in sugar management, the baby tend to have a lot of issues like having high baby birth weight, which leads to cesarean sections and which leads other complications like excessive fluid, all those problems. Or the extremities can occur in diabetes like having very low birth weight of the baby or very low amniotic fluid. So to avoid these problems and sometimes to manage the mother's health, we usually give importance to mother's health. To maintain the safeguard of mother, we need to deliver the pregnancy before the time indicates. So in those, to avoid these kind of complications, we do ask the woman to control their blood sugars before becoming pregnant. So this is in short for diabetes. Same as for thyroid also. If the thyroid woman is having thyroid problems, thyroid itself causes subinfertility because it delays the conception of the woman. So in this scenario, we ask you to control your thyroid levels, have optimum levels of thyroid levels, and take proper amount of thyroid medication, and then plan for the pregnancy. Same in conditions of heart disease problems. There are so many heart disease problems where a woman can safely become pregnant at the same time, needs minimum amount of care and treatment protocols once the woman becomes pregnant. Regular monitoring of her cardiac status, regular monitoring of her pulse rate, breathing capacities, all those things does matter when a woman becomes pregnant, because when a woman becomes pregnant with the underlying cardiac diseases, the changes does occur in pregnancy impose a lot of effects on heart actually. The blood supply to the heart increases up to 40%, and that heart has to cope up with all these problems since woman become pregnant. And the mode of delivery also planning very important in this kind of pregnancies. We need to safeguard the fetus also, that is baby, and we need to safely deliver the mother whatever way it is possible and whenever it is indicated. These are all the conditions which exist pre-pregnancy. But sometimes when the woman becomes pregnant, she may be absolutely normal without having any underlying problems like hypertension or diabetes or thyroid issues or PCOD related problems. But once a woman becomes pregnant, sometimes the body may not be that much cooperative or cannot adjust the changes that occur during the pregnancy. So the woman tend to develop some other kind of problems, same as increase in sugars, thyroid levels may increase, or blood pressures may increase, because the pregnancy poses a lot of burden on all the organs of the woman, like heart does changes, lungs does changes, her liver functions does changes, her kidney does effects with the pregnancy changes. Pregnancy secretes some kind of hormones, which hormone works on all the parts of the body of a woman. So in that cases, how do we manage? As long as woman is getting treatment with the obstetrician, following the guidelines, following the treatment advices which are given by the obstetricians, and not developing any problem, it is called a low risk pregnancy. We really don't interfere unless otherwise it is mandatory or some signs will rise up in pregnancy. But when a woman after reaching around 5th month or 4th month tend to develop hypertension and high blood sugars, then again we, depending on the range of the sugars, depending on the range of the blood pressure monitoring, we need to take some super specialty consultation like cardiologist or diabetologist or endocrinologist. We does maintain the cases, and we, that where the importance starts actually. You need to be very meticulously follow the advice of the gynecologist or obstetrician who's treating with you. So don't take things light. Another thing which recent trends is showing is lifestyle changes. Lifestyle changes are becoming enormously abruptly changing. A software professional, for example, they have all kind of habits like boozing or drinking alcohol or smoking. There may be lifestyle change. Those changes are very much adapted on this present scenario. That may be normal for your lifestyle, but when it becomes to pregnancy, smoking and alcoholism does causes problem in the pregnancy, especially a woman who's a regular alcohol intaker need to cut down and cut short their alcohol intake with the woman is planning for pregnancy, because alcohol does change. It does have a lot of organ anomalies in the developmental stage of the baby. That is the first 3 months of the pregnancy. So whenever a woman plans, so they need to consult a obstetrician and tell their issue and how to cut short and how much gap need to be taken out before they become actually pregnant. This is all comes under pre-pregnancy counseling. That's why we always impose and advise everybody. We insist on a woman to come pregnancy counseling before actually they plan for pregnancy. Both wife and husband need to come down, sort out all the issues like smoking and sedentary lifestyle changes and alcoholism, smoking, all those things, and working patterns. All entire world will be working in daytime, and our software professionals does work in night times, because various issues, various companies they are allotted, or various companies they need to log in at the time. The working hours does change, but those changes, with those kind of changes, how do they manage their pregnancy? All those things comes in a pre-pregnancy planning only. And again, age is very important factor. Another most important factor in high risk pregnancy, a woman who becomes too early pregnant too early, that means below 18 years of age, her body is not matured enough to carry forward the pregnancy. So these people tend to develop hypertension changes and placental problems. Plus the uterus is not really ready for the pregnancy, so uterus undergoes lot of changes. So placenta will become implanted abnormally. Placenta implantation is supposed to be on the earlier in the upper segment, but in these cases the placenta implants low in the lowest uterine segment, and they tend to bleed, they tend to deliver abruptly, they tend to have early deliveries. At the same time, these are the girls who are more prone for development of hypertension disorders, most importantly, and these are the women more importantly develop the thyroid problems also. At the same time, age after 37 years also we called as a elderly prime. By textbook definition, elderly prime is above the 35 years only, but changing trends keeping in view, we are telling women to become pregnant as early as possible. Of course, I do understand pregnant career is very important, but prioritization is important. What time priority should be given to which job, career, or pregnancy once you get married. So all those things are personalized, but prioritization is also very important at the same time. A woman conceives after 37 years of age or 36 years of age are more prone for becoming diabetic during the pregnancy. And the woman once becomes diabetic during pregnancy tend to get diabetic very early. Like suppose a family history is there, a woman is tend to become pregnant, tend to become diabetic at the age of 60 years. But a woman becomes diabetic during pregnancy tend to become diabetic at the age of 40 years only. This is the risk involved in diabetic pregnancies. That's why we tell you So plan your pregnancies properly and take proper advice of obstetrician. Please do give importance and prioritization once you become pregnant. Few people I do see, today I didn't get leave, today I have an emergency meeting, today my meeting could not be postponed, but that is not the reason to be avoid that antenatal visits. When we plan certain growth scans or certain type of investigations, please do not neglect them. Prioritize what is given to be important. With that, I close this topic very shortly. I spoke. There's actually a lot to speak, but as of now, that's it. Thank you very much.